Anal cancer is a specialized type of cancer. The anus is a very hyper-specialized portion, the very end portion of our gastrointestinal tract. The reason the anus is so important is it serves two main functions. Number one is it samples what's coming through, and the nerve endings in your anus allow you to tell the difference between gas, liquid, and solid, which again is another thing that's often taken for granted until it's not working correctly, and then you can't trust a fart anymore. The second job of the anus is that it's surrounded by muscles which control our continence. And so conditions of the anus that interfere with that are also very debilitating and cause a significant quality of life. Anal cancer itself is a type of squamous cell cancer, and it much more likely resembles skin cancer. The anus is a part of our body where the colon and the skin come together, and that makes it much more prone to developing skin-type cancers. It's also very akin to cervical cancer in a woman, because in a woman, the cervix is an area where two different types of cells come together, and those areas are more prone to cancer. Similar to cervical cancer as well, anal cancer is also highly related to the HPV virus. Now, the reality is that the HPV virus is so prevalent across the world that roughly 70 to 80% of the world's population already carries some strain of the HPV virus. Fortunately, the vast majority of them are not dangerous at all. They just sort of exist. But there are a few strains that are more prone to developing warts and more prone to developing cancers. So any abnormal bump that you may feel, any bleeding that you may see, these are often, people will say, oh, it's a hemorrhoid, just go away. But if it persists, get it checked out, because it does not take much to identify what's a hemorrhoid and what's not a hemorrhoid. And certainly these are the things that we try to catch early. We do have excellent treatment, and the effective cure rates of treatment for anal cancer are very high, provided that we catch it early. Once anal cancer spreads, it's almost near impossible to treat, and it can become very difficult.